Look at the back of your arm right now. That loose skin is not what you think it is. You have been told it is fat. You have been told to diet, to exercise, to wait. You were misled. This is not a fat problem. For 99% of adults over 45, what you are seeing is a structural breakdown, and treating it like fat is exactly why nothing has worked. My name is Dr. Chris Health, and I have spent years watching people exhaust themselves on the wrong solution. They lose weight, and the skin stays loose. They do endless arm curls and nothing changes. They spend money on creams that do absolutely nothing. Here's why. They are treating the surface of a problem that lives much deeper. The looseness on the back of your arm comes from 3 specific failures happening inside your body right now. None of them are fat. First, the connective tissue beneath your skin has lost its structure. Second, fluid is pooling in your upper arm because a key muscle has stopped working. Third, your body has quietly stopped producing enough collagen. And there is one deficiency driving that collapse. Here's where it gets worse. These 3 things are connected. When one fails, it accelerates the others. Here is something worth sitting with. The upper arm is one of the thinnest skinned areas on the entire body. There is very little subcutaneous fat beneath the skin of the posterior upper arm compared to the abdomen or thigh. That means structural changes show up there sooner and more visibly than anywhere else. It is not that your arms are worse than the rest of your body. It is that your arms are the most honest part of your body. They show you what is happening everywhere else before those other regions make it obvious. And most people have no idea any of this is happening until they look in the mirror and wonder what went wrong. Let me explain each one, because once you understand what is actually happening, the fix becomes obvious. The cosmetic industry has a financial interest in you believing this is a fat problem. Fat problems have fat solutions, and fat solutions are expensive. Structural problems, lymphatic problems, nutritional deficiencies, those are largely free to fix. That is not a comfortable business model. So the conversation gets redirected every time toward the surface, toward the skin you can see, away from the tissue you cannot. Directly under your skin, not inside the muscle, not deep in fat, there is a thin web of tissue called fascia. Fascia is your body's internal scaffolding. It wraps around your muscles, separates tissue layers, and physically anchors your skin from below. When it is healthy and hydrated, your skin sits firm and responds when you move. When fascia dries out and develops adhesions, isos, meaning layers that should slide freely, have stuck together, your skin loses its anchor. It starts to drape instead of hold. That draped, hanging quality is what people call saggy arms. It is not extra volume. It is a scaffolding failure. There's something else worth understanding about fascia that most people never learn. Fascia is approximately 70% water. It does not function like a dry structural element the way bone does. It functions like hydrated living sponge that transmits force, supports shape, and responds to pressure and movement. When the body is chronically dehydrated, even mildly, the kind of dehydration you would not notice as thirst, the fascia is one of the first tissues to lose moisture. It contracts, it thickens, it becomes sticky where it should be smooth. This is why the quality of your daily hydration matters for how your arm looks. Not because water washes away fat, but because the scaffolding holding your skin up is mostly made of water. Drinking adequately throughout the day is not optional supplementary advice. For fascial health, it is foundational. Think of it like the wall of a building, where the brackets holding the cladding have corroded and pulled away. The surface is not too heavy. It just has nothing left to hold it up. Most people miss this completely. They try to shrink the arm instead of rebuilding what is holding it. Here's the second failure, and this one surprises almost everyone. Your upper arm has a lymphatic drainage problem. The lymphatic system is the body's fluid management network. Unlike your circulatory system, it has no pump. It moves fluid through the body using one thing: muscle contraction. The muscle responsible for draining the upper arm is the triceps, the muscle running along the back of the arm. When the triceps is underused, which is extremely common in adults over 40, fluid pools in the tissue. It does not look like dramatic swelling. It looks like soft, doughy puffiness that does not respond to dieting. You press it, and it feels different from the fat on your abdomen. More yielding, more uniform, strangely consistent. That is stagnant fluid sitting in tissue that stopped moving it. Let me be more specific about what lymphatic stagnation actually looks like in the tissue, because this matters for understanding what you are feeling when you touch your own arm. Healthy lymphatic flow keeps the interstitial space, the microscopic gaps between all your cells, relatively clear. When flow stagnates, proteins and cellular waste accumulate in those gaps. The tissue becomes progressively more congested. Under your fingers, it feels soft, but somehow full. Not squishy like edema, not firm like muscle, something in between, a texture that does not quite belong. That texture is the physical signature of lymphatic congestion, and it will not change no matter how little you eat, because food intake has almost nothing to do with it. What changes is myelina's movement, specifically the movement generated by a triceps muscle doing its job. This is the real problem that no cream or procedure will fix. The triceps is one of the most neglected muscles in the entire body. Walking does not activate it. Typing does not activate it. Even common gym routines largely ignore it. So the fluid just sits there year after year while the arm gets progressively softer. Now here's the third failure, and this is the one that ties everything together. Your body's producing less collagen than it should. Collagen is the protein that gives connective tissue its strength and elasticity, its ability to hold a shape under load. After 40, collagen production naturally declines. But here's what most doctors never check. Vitamin D deficiency makes that decline dramatically faster. Vitamin D directly regulates the genes responsible for collagen synthesis. Without adequate levels, your body produces less collagen and breaks down what remains at an accelerated rate. The result is not just loose arm skin, it is a system-wide softening of connective tissue. The jawline starts to go. The abdomen loses its tone. Vein walls in the legs weaken. The arms are simply the first visible warning, because the skin there is thinner and has less fat beneath it to mask what is happening. The vitamin D and collagen connection has another layer that rarely gets discussed. Collagen fibers in the skin are not static structures. They are constantly being broken down and rebuilt in a cycle called collagen remodeling. Under normal conditions, the breakdown and rebuilding stay roughly balanced. But when vitamin D is deficient, the enzymes that break down collagen, called matrix metalloproteinases, become overactive. They break down faster than the body can rebuild. The balance tips toward net loss. And this is happening continuously, every day, in every tissue that depends on collagen for its structure. The skin thins, the fascia weakens, the small ligaments around joints loosen. The visible result on your arm is just the most obvious window into a process that is occurring throughout the entire body simultaneously. Here's the part that should concern you. This is not a cosmetic issue. This is a diagnostic signal. When I see significant loose skin on the upper arm of a patient over 45, I test vitamin D levels immediately. Consistently, those levels come back in the deficiency range. One patient, a woman in her late 50s, had visited 2 dermatologists and a plastic surgeon over 3 years, specifically about her arms. All 3 told her surgery was her only real option. She came to me for something unrelated, fatigue and recurring headaches. During the assessment, I noticed her arm skin and asked about it. She said she had simply stopped wearing short sleeves because she assumed it was just part of getting older. Her vitamin D came back severely deficient. She had been slowly dismantling her own connective tissue for years without knowing it. That is not a rare case. That is the pattern I see repeatedly. The cosmetic industry does not benefit from this conversation. Procedures, lasers, and tightening devices are built on one assumption, that your problem is excess tissue that needs to be cut or burned away. When results fade in 6 months, the explanation offered is always the same. You did not maintain, you ate the wrong things, you aged, the accountability stays with you, and the appointment calendar stays full. Here's where it gets worse. The underlying cause, the collagen deficiency, the fascial breakdown, the lymphatic stagnation, continues completely untreated. So the problem returns every time for the same reason. I want to address the fear directly because it is present in almost every person I have this conversation with. There is a specific dread that comes with watching your body change in ways you did not choose. It is not just about appearance. It is about the feeling that the process is running without your input, that your body is making decisions you were not consulted on. That feeling is real, and it deserves to be taken seriously rather than dismissed. But here's what I want you to understand. The changes you are seeing are not random. They are responses to specific, identifiable conditions, conditions that can be changed. The fascial adhesion developed because the tissue stopped receiving adequate movement and circulation. Give it movement and circulation, and the biology responds. The lymphatic congestion developed because the triceps stopped working. Give the triceps consistent work, and the lymphatic system responds. The collagen loss accelerated because vitamin D was insufficient. Correct the deficiency, and collagen synthesis responds. None of these are permanent sentences. They are temporary states that have lasted long enough to become visible. The body does not experience them as permanent either. It is waiting for the conditions to change. Now, I am going to give you the 4-step protocol I use clinically. These address the actual causes. They cost nothing. They take approximately 5 minutes a day. There is one more element of the protocol that people consistently underestimate, and I want to address it directly before moving on. Sleep is when the body performs the majority of its connective tissue repair. During deep sleep, human growth hormone is released in its largest daily pulse. Growth hormone directly stimulates collagen synthesis and fascial repair. Adults who sleep fewer than 6 hours consistently show measurably lower rates of connective tissue renewal compared to those sleeping 7 to 9 hours. If you are doing the massage, the exercises, the stretching, and correcting your vitamin D, but sleeping 5 hours a night, you are doing the repair work with one hand and undoing it with the other. The quality and duration of your sleep is not separate from the health of your arm skin. It is part of the same biological system. Step 1, pinch massage. This directly breaks up fascial adhesions and reopens capillary blood flow in the tissue layer just beneath your skin. Sit down and extend one arm out, palm facing up, resting on a table or your knee. The muscle must be completely relaxed. Using the thumb and first 2 fingers of your other hand, pick up a small fold of skin and the thin tissue immediately beneath it on the back of your upper arm. You are not grabbing deep into the muscle. You are in the top layer only, skin and the fascia directly below it. Roll that fold gently forward and back between your fingers. You should feel mild pressure and slight warmth. If it is sharp or painful, you are pressing too hard. Work slowly from the elbow toward the shoulder. At certain points, the tissue will feel stuck or resistant. Those are adhesions. Spend 15 to 20 extra seconds on each one. You are not forcing anything. You are reintroducing motion to tissue that has been starved of circulation. Do both arms. The whole process takes about 3 minutes. Do it every morning. Step 2, narrow grip push-ups. This is the only body weight movement that directly activates the triceps through its full range of motion, which means it is the only movement that will consistently pump lymph through the upper arm. Come to your hands and knees if a full push-up position is not accessible to you. Place your hands slightly closer than shoulder width, thumbs roughly 4 inches apart, fingers pointing forward. Lower your chest slowly, keeping elbows pointing straight back along your sides. Feel the back of the upper arm engage as you descend. Push back up, exhaling as you extend. Do not lock the elbows at the top. Start with 5 repetitions. If 5 is too many, start with 3. If 3 is too many, do 1, rest, do 1 more. Consistency matters more than volume. Work toward 3 sets of 10 over the course of 4 to 6 weeks. Step 3, the 3-phase triceps stretch sequence. When the triceps is chronically tight and shortened, the fascia around it contracts to match. That contraction compresses the tissue above it and restricts lymphatic flow through the entire arm compartment. Restoring muscle length restores fascial length. Restored fascial length gives your skin its foundation back. Phase 1 is the overhead stretch. Raise one arm overhead and bend the elbow so your hand drops behind your head. Use your other hand to apply gentle downward pressure on the bent elbow. Hold for 30 seconds per side. You should feel the stretch running from the back of your elbow, up through the upper arm and into the shoulder. Phase 2 is the wall stretch. Stand facing a wall and place the back of one hand flat against it at shoulder height, fingers pointing down. Rotate your body away from the wall, turning your chest and hips while the hand stays in contact. Hold for 30 seconds per side. You will often feel this into the armpit, which is exactly where the lymph nodes that drain the arm are clustered. Phase 3 is seated gravity extension. Sit upright in a chair. Extend one arm straight in front of you at shoulder height. Rotate the palm to face the ceiling. Allow the arm to hang slightly under its own weight. Do not force it up. Hold for 45 seconds per side. You may feel the muscle trembling slightly as it releases. That is chronic tension finally letting go. Do the full stretch sequence once daily, ideally right after the pinch massage. Step 4, get a specific blood test. Write this down exactly and bring it to your next appointment. Ask for a 25-hydroxy vitamin D test, not a standard vitamin D panel, specifically 25-hydroxy. Standard panels often test the inactive form of the vitamin, which does not tell you what your body actually has available for collagen synthesis. The 25-hydroxy test measures the storage form, the number that matters. If your level is below the clinical sufficiency threshold, supplementation under your doctor's guidance is appropriate. If it is in the severe deficiency range, the connective tissue deterioration has almost certainly been underway for some time. One more critical point on supplementation. If your doctor recommends vitamin D3, take it with a meal that contains fat. Vitamin D is fat soluble. Without dietary fat in the stomach at the time of ingestion, most of the dose passes through without being absorbed. A spoonful of nut butter, a small handful of walnuts, or any fat-containing meal is enough. This single adjustment can dramatically change how much benefit you actually receive from the supplement. Most people miss this. They supplement for months and wonder why their levels do not move. Leave your age in the comments right now, just the number. It changes what I can tell you about where you are in this process. I want to tell you about a second patient, a man, 63 years old, who had spent decades doing physical work and then retired almost overnight into a completely sedentary life. Within 18 months, his arms had changed enough that his wife mentioned it. He came to me about declining grip strength, not his arms. During the assessment, I found his vitamin D severely deficient, and the fascial tissue on the back of both upper arms was significantly adhered throughout the posterior compartment. His triceps had the tone of a muscle that had not been meaningfully challenged in years. We worked through this exact protocol for 8 weeks. He did the massage every morning before his first coffee. He did the push-ups on his knees because his wrists were not yet ready for a full position. He got his vitamin D corrected under his doctor's supervision. At the 8-week follow-up, he pushed up his sleeve, looked at his arm for a long moment, and then said something I have not forgotten. He said, "It feels like it belongs to me again." Not that it looks better. Not that the skin is tighter. It feels like it belongs to me again. That is what becomes possible when you stop fighting the surface and start addressing what is underneath it. The body has a genuine capacity to rebuild connective tissue when the conditions for that rebuilding are restored. It does not work at the speed of a surgical procedure, but it works with the consistency of biology. And that consistency does not require maintenance appointments or repeat spending. To bring everything together, what you are most likely dealing with is fascial adhesion in the layer just beneath the skin, lymphatic stagnation caused by a chronically unused triceps, and collagen synthesis suppressed by vitamin D deficiency. The response is daily pinch massage to restore capillary flow and break adhesions, narrow grip push-ups to reactivate the triceps and drive lymphatic drainage, a 3-phase stretch sequence to restore fascial length throughout the arm compartment, and a 25-hydroxy vitamin D test to identify and correct the deficiency, accelerating connective tissue loss throughout your entire body. None of this costs money. All of it requires consistency over weeks, not dramatic effort over a single day. The arms are where the problem is visible. The correction works at a level that benefits far more than the arms. Everything presented in this video is general health and wellness information for educational purposes only. It does not constitute personal medical advice, and it is not a diagnosis of any condition. Every person's body is different, and the same visible symptoms can have different underlying causes depending on your individual health history, current medications, and other factors your own doctor is aware of. Before beginning any new exercise routine or supplement regimen, particularly if you have a history of joint injury, lymphatic conditions, blood clotting disorders, or any chronic health condition, consult your physician or a qualified healthcare provider. The purpose of this content is to help you ask better questions and have better informed conversations, not to replace the professional who knows your specific medical history.